Hello, everyone, and welcome to Healthy with an Attitude. It's October, which also means it's Breast Cancer Awareness Month. And Black women are still more likely than white women to die from breast cancer in the U.S. According to the American Cancer Society, Black women have a 4% lower incidence rate of breast cancer than white women. However, a 40% higher breast cancer death rate. So we want to talk about why. Dr. B and I not only want to spend some time exploring that question and additional questions, but she'd also like to share her personal story on this topic that we hope will inspire others to face their own situation head on.
This topic is near and dear to my heart. When we talk about breast cancer, the narrative of who it affects, how it can affect is often missed. A couple of years ago, I wanted to, again, as I always have, advocate for awareness and provide information. So I thought to myself, what can I do in a new kind of non-traditional format? And so I needed to get my first mammogram, and I decided to record it because I thought, I often hear from my patients, there's concerns, there's fears of, what will the exam be like? Will it hurt? Will it take a lot of time? So I decided to record it in hopes that I could possibly help more people understand the process, but also have the opportunity to save their life. A couple years ago, went in, recorded my journey of getting my mammogram, really just provided insights that I think often are missed when we hear about what does it involve. And I ended up getting my results about a couple of days later, and I received a phone call, and I was told that I had calcifications and that I needed to get a diagnostic. It was really interesting, Eugene, because, I've been a physician for quite a bit of years. And I've heard my patients say to me, Dr. BCW, what does this mean when I've shared with them you have an abnormal result and that you have to get further screening? And here, this was actually happening to me. I had this moment of fear, anxiety of the unknown, and I was scared. But I knew I needed to get this done so I could actually respond. And I think that part is so important. Although often we don't want to know bad news and so forth, it's important that we at least hear what the situation is so we have the best opportunities. That being said, I decided, based on the stories, the experiences I've had with my patients, to go ahead and memorialize what the second step if you have an abnormal mammogram. I recorded it as well, including getting my results live. And I'm so grateful that I was told that I was normal. But I did it because I was just hopeful that I could help any person out there, any gender, race, or ethnicity that may be either facing something similar or just nervous about getting a mammogram, that might just encourage you into just going for it and getting it done. And since then, I have recorded my mammogram every single year. Wow. And the one part I've always included in a level of authenticity, I think a lot of people can relate to when you've had an abnormal result, when you've had news that you didn't expect, and then you have to continue to follow up. There's an ongoing fear and anxiety. Oh gosh, what happens if this year I get those same results, or something might not be what I expected? I record that and I share that. So every year, my hope is to raise awareness, provide information so people can be informed for not only themselves, but also their loved ones. This is so important to me.
Incredibly inspirational, incredibly brave. I'm sure having kind of been able to tell your story in that way every year, that you have affected people in a very positive way, to not only think about it a little bit differently, those tests a little bit differently, but also, like you and I talk about a lot, pollinate your community. Like tell people, hey, Dr. B had this thing on a video she recorded her test annually. And, I don't think it's that bad. Like, I think it may be a woman and a friend, it might be a mother and a daughter. I think we should probably take this a bit more seriously and get tested on a regular basis. One thing I did want to mention is I've learned much more about this topic over the past, to be quite honest, a year or so. Women do not get tested until there's a certain age. So as a man and learning much more about this, the assumption that many people may have is that as soon as you become a woman, whatever a woman means, you kind of transition from being a girl to a woman, and that could be at the age of, let's just say 18, you begin getting mammograms at that point, which I believe is not the case. The test begins a little bit later in life. Can you talk more about that? And from a Black woman perspective, with Black women dying a lot more frequently, do you think if the age is, say, 40, should it be lowered to maybe 35 for Black women, etc.?
So when we look at, when should you get your mammogram, there are now different guidelines out there, and it can be quite confusing because one guideline is stating age 40, some are still saying age 50, others are, have a conversation with your clinician. When I think about when is the best time for you, I think it's important to take inventory of your health status at this point. And that could mean if you're 18, 20, 30, 40. Also include in that your family history. Now, I'm very careful when I say that because 80 to 85% of breast cancer is not associated with family history. However, if you have a family history, that needs to be part of your playbook and thought process of when you should get a mammogram as well. Right now, we know, as you mentioned, that Black women are dying at the highest rate. Although we have a lower number of cases. Yeah. We're also diagnosed at a later stage, and we have the most aggressive type of breast cancer. And so when you add all of those factors, it's really important to kind of have that individual decision while discussing it with your clinician and get screened. I think it's important that we don't limit it to an age because it's possible that you need to go in sooner. And we're hearing now more and more women and birthing people and men getting diagnosed at stages we've never seen before. So it's important that we mention men have a risk of getting breast cancer and birthing people and women. That's why I'm so glad we're discussing this.
For sure. Absolutely. In my prior primary care physician, it was a very, very focused point of our examination on an annual basis. So I would say to all men, if your physician is not doing the same, you should fire that person immediately. Let me ask you about, because you talked a bit about family history. What about genetic tests? There is a lot of buzz around genetic tests. Do they really matter? Do they really work? Would you consider genetic testing as far as based on family history and just trying to be a bit more proactive around a possible breast cancer diagnosis to be a good idea?
I do. So, when I think of genetic tests, it's important that we kind of highlight why that test is important. So when we hear the statistics about Black women dying at the highest rate, I like to uncouple that, this. And why are Black women dying at the highest rate? We have to look at how often are screenings being offered based on the color of your skin. What biases are possibly a part of that rate of disease. And so, especially when we tie in the fact that race is not genetic. And so when we look at genetics, we look at your, African, those pieces. And so there are links to diseases based on that, but the color of my skin is not linked to that rate of disease. And so I think genetics testing is so vital. But again, we also have to remind ourselves that you could still get it even if you don't have a family history. So all of those pieces are important when you think of breast cancer.
And that makes perfect sense. So when we put all of the pieces together, when we talk about genetic tests, when we talk about early diagnosis, or at least being a bit more proactive around when you have a mammogram. And then you add in the ingredient of lifestyle. What are your thoughts around lifestyle? Would that help if your lifestyle may be improved in certain areas, more exercise, lose a little weight, less alcohol intake. But those adjustments, or some adjustments in lifestyle, also help make an impact on a potential breast cancer diagnosis.
Yes. I'm a big believer in, the food that we consume can make a difference. We are seeing now more than ever, more processed foods, more things, or more foods that we weren't eating years ago. Take note of that. And then you look at the increased rate of diseases that are happening for people at a younger age. I do believe that there's environmental pieces. All of those things are a part of the picture. It doesn't mean it's just one part. Foods that we consume can play a role in developing or possibly increasing your risk of cancer. When it comes to exercise, we know that getting out, running, being active, having more oxygen to all of those vital organs that that help us do what we do every day can be huge, because when you don't have that, those organs can't function as well. So I think exercise, food, lifestyle choices can make a difference. But it's also important that we look at, you've seen people who have amazing lifestyle choices and they do everything right. And unfortunately, they have, received the diagnosis of cancer. But one part that can make a difference, which you and I, that's why I love what we get to do, is being informed and knowing all of knowing as much as you can in hopes of getting screened, even if you don't have a family history, even if you have a great lifestyle per se, based on all the right foods and so forth, it's still important to get screened.
That is a really, really important message. One thing I'll add to that is that I like to mention in many of our conversations is drink more water. That sounds so simple and it's a little bit understated, but it is critically important, especially when you get older. And you mentioned, the function of vital organs, blood oxygen. Water is an important component to all of that. So, when it comes to making lifestyle adjustments, and whether it's breast cancer, prostate, the long list of things that we want to make sure that we're proactively at least delaying. Some of these situations are going to be really tough to stop, but we have a great opportunity to at least delay, manage, and then live very high level lives on the back end. There's some simple life hacks, a little bit of exercise, a little bit more water, a little bit less, alcohol or foods that might be a little bit too salty or fatty, and get another hour or so of sleep when possible. Those things you put those building blocks on top of one of another, and by the time you know it, you've kind of created a lifestyle that's adjusted itself just enough to buy yourself some really, really valuable years in the back end. So, Dr. B, thank you so much for sharing your story. Everybody, please don't be shy. Reach out directly to both of us. Also, think pink. We are wearing pink on purpose because of Breast Cancer Awareness Month. If you don't want to leave comments publicly, if you want to talk to Dr. B directly, and she's absolutely a terrific resource for us all, please reach out to her directly as well. But as always, this is for our community. So push it forward. Remember to have a safe and enjoyable fall. And like always, be healthy, be better, and please live better together.
Yes. Thank you.